This segment of Delmarva Life is brought to you by Peninsula Home Care.
Okay, so most of us have had some type of surgery at one point or another, or maybe just a serious injury. Now, it's two different circumstances, but there's usually one common factor between them, and that's the wound that's left behind. Sometimes it seems like that wound can take forever to heal. Well, there's a form of therapy that can cut down on your healing time, and it's called chronic wound care electrical stimulation, or E-STIM. And joining us today to tell us more about it are Nancy Begwell, she is the Peninsula Home Care Branch Director, David Barnes is the PHC physical therapist, and Julie Jokery is a patient. Thank you so much for coming in this afternoon. Nancy, we've talked E-STIM before.
We have.
Remind me what it is, how it works.
Well, this is so exciting because the original E-STIM that we talked about is probably more of a gentle electronic stimulation that helps with pain. It can also help with range of motion through a pattern.
Right.
This E-STIM is, Peninsula Home Care is the first to bring it to the Eastern Shore, actually the first in Maryland. Yeah. And it's a high voltage pulse that, although it sounds very painful, it really isn't, no.
Okay.
But what it does is it improves the circulation to the wound.
Oh,
so it makes the blood flow and brings your body to a more healing process.
Okay, and is this for anybody? Can anybody do this?
Well, actually, it's for more of a chronic wound. It's for people who have pressure ulcers or diabetes. And the reason what makes it different is that our team of therapists since 2011 have really been working with E-STIM. But this type of training actually teaches them a different set of assessment skills.
Right.
They have to know disease processes. They have to talk about what indications or contraindications is necessary for that kind of thing. And so it really can make the healing time be about 40% less than without it.
Wow. Okay, Dave, don't go anywhere. I want to talk to you seriously. So, Julie, you've seen this firsthand. Tell me your story real quick.
Yes. After having diabetes for 30 years, I started having problems with circulation with a leg. I ended up having to have an amputation about 3 months ago.
Okay.
After that, I had a particular therapy called...
Is this the vacuum treatment? Yeah. But it's to help you heal.
To help me heal.
Okay.
It was doing a good job. It was just kind of cumbersome. I had to hold it around my neck when I was using crutches. Wherever I was going, I had to have it on 24/7.
So you hauled this around with you?
Yeah, it was pretty small, but sometimes it could be cumbersome.
Okay.
Especially when I was using crutches.
So how did you wind up with E-STIM?
Well, E-STIM, my physical therapist, David, I had never heard of it, didn't know anything about it. Physical therapist David actually talked about it, recommended it to me.
Yeah.
Said that it made wounds heal much quicker. He asked maybe I should ask my surgeon, would that be something that they would recommend? Would it work for me?
So you decided to try it?
Yeah, so I decided to try it.
And?
I was thinking to myself, this will, I'll see results maybe 2 months down the road,
yeah.
maybe 3, but I'll try it if there's anything that would help, I'll try it. Anything to help heal this wound quicker. He did it the first day. It's a 45-minute treatment.
Right.
And 2 days later, when he came back, I noticed a big difference. So from there, we've been doing it.
Wait a minute, how quick?
In 2 days. 2 days, I noticed a big difference. Yes, yes.
So as far as healing and what you could do, wow.
Yes.
Wow. 2 days. Okay, we're going to show you some pictures here real quick. I want you to take a look at this. It might be a little bit graphic, but we want you to understand the healing properties when we're talking about a wound here. Here's the wound before the E-STIM treatment, okay? Now take a look at this. What's happened since the E-STIM treatments? Okay, now, we're going to get to the physical therapist part of this whole thing. I'm going to be your test patient, okay?
Okay.
So, can you hook this up to me and show?
Absolutely.
Show me how this works? Now, you said high voltage, right?
I did, but don't be afraid.
It's okay.
It's okay.
It's not a big deal.
It's great.
I'm not going to go jumping out of the chair or doing anything.
No, we hope not.
All right, what are we doing?
Okay. So if you were to have a wound on your arm,
okay,
and the wound was there, we would hook you up below and above the wound. What this is going to do is it's going to create an electrical field. Just your body's natural healing ability with the lymph system, the blood flow to this area is going to be increased between this area.
Because of the
electrical pulses going between the two.
Okay.
So we've got you hooked up, and then in case you're nervous,
okay, what's that?
We will give this.
Is this your ejection seat?
That's the ejection seat. Okay. That's the kill switch.
Run that in my arm.
So,
okay, there we go.
If anything ever becomes unpleasant, you can always hit the kill switch.
Oh, so I'm in control of that.
You're in control.
Okay.
You're in control. So what I'll do is I'm just going to bring this up, and you tell me when you start to feel something in your arm.
Well, it's not doing anything.
Okay, we're going to bring it up a little
You
bit.
can take off
You're going
in
to fix that.
We're
are
going
you?
to fix it. And
Well, I'm
this
starting to feel something in my thumb.
okay,
I can
and,
feel something in my arm.
and that's all that we would do.
And that's it, really?
That's it. So
It's like a little buzz. That's
right,
really about
it's a
all
little
there is to it.
buzz. So it's called high voltage, but don't let it scare you. This is
Right.
all you're going to feel. Then this is going to run for about 45 minutes.
And I sit here this whole time with this thing on my arm, and that's it.
That is not it. Then we look at what else you need. So if you've got an injury to your wrist, it's going to affect your fingers, it's going
Right.
to affect your flexors. So we can come in here and hold you like this.
Yeah.
I can have you pull against my
So I-
hand, right?
Oh, and that's separate from the E-STIM.
That's
but I can
separate
still
from the
exercise
E-STIM. So we do arm exercises,
several things at one time.
several things at one time. Julie was talking about the wound vac.
Yeah.
When she originally started, we put the wound vac on. It's a seal. It's got a drain. It goes to a pack that suctions the bad things from the wound.
But you got to carry it around.
You've got to carry it around. It's on your shoulder. You've got to run the hose through your pants, and you have to sling this over, and you have to walk with your crutches. Very cumbersome.
Well, let me ask you this. I've seen stuff like this in TV commercials. Can't I just go out and buy one of these things and do it myself?
No, it's a high volt current. This is specifically for wound healing.
Okay.
And that's where
So you need to
the
train for
additional
it.
training of anatomy and physiology and disease processes comes in.
Okay.
Because it makes it quite different than the traditional E-STIM that you would see for muscle spasms and that sort of thing.
I understand.
So that's what happens.
David, Nancy, thank you so much for joining us.
Sure.
Julie, before I let you go, what are your goals now? What are you looking forward to?
Well, to healing the wound that I have,
Yeah?
getting a prosthetic on the leg, and getting back to work.
Yeah?
Getting back to work, yeah. I'm a dental hygienist. I've been one for 24 years.
Oh, this had to have been tough then.
Yes, definitely. I've worked at the same office for 23 years, so I'm missing my patients. A lot of my
Oh,
patients,
my
they're like family.
Yeah.
So I want to get back to work, get cleaning their teeth,
Okay.
and get back to a normal life.
Julie's on her way back. Y'all just be patient. Again, Nancy, Julie, Dave, thank you so
Thank
much.
you.
Thank
This
you.
has been fun. Now, if you'd like to read more about Peninsula Home Care and more about the services that are available, all you have to do is go to WBOC.com, then click on our picture at the top right part of the page. Okay, so that's therapy for people. Well, how about if we turn to therapy for pets? It's helping all types of animals, from dogs to bulls. We're going to see how it works next. Plus, how often do you wash your jeans? Believe it or not, there's a lot of debate over the question, and we're going to take a look at both sides so that you can decide what's best for your denim. And a little bit later on, he's played with some of the biggest names in baseball. Mets Hall of Famer Mookie Wilson joins us to talk about some of his more memorable moments and what he says about the use of steroids in sports today. Delmarva Live. We'll be right back.